I'll be talking to you about energy medicine going mainstream. So energy medicine is as old as human history. Since man crawled the earth, there was energy medicine around. Let's look at the shaman. At least 15,000 years going back, using the elements of nature, fire, wind, the earth, water, animals, trees, plants. They used their voices and their bodies to help heal the negative spirits that impact the physiology. So rather than treating the body, the shamans believe that it's a spirit that is negative and that causes disease. Or we look at the Egyptians. Egyptian priest doctors, 1600 BC, still the connection between religion and medicine. And they were quite advanced in that time. We think that only we are advanced in this 21st century. You know, they knew how to set bones. They knew how to analyze curable and fatal diseases. And they had the goddess Ma'at, and her symbol was a feather, which was to access the vibrational qualities of justice, truth, balance, and order. The energy was accessed by using intention. Now we go into the Sufi way. This predates religion. The elect divine messages and prophets who were gifted with the precious gift of pure self-surrender to the Absolute were also gifted with the healing energy, which gushed forth from the energy of pure love and unconditional compassion. And a contemporary energy healer says that to heal is to become one with deep love of God. That's beautiful. Now we go to Greece, 400 BC. Ancient Greek manuscripts describe the laying on of hands. And Hippocrates, the father of modern medicine, his writings define energy as the force which flows from many people's hands. And while we're in Greece, I thought to just bring in Socrates. Love this statement. The only real wisdom is knowing that you know nothing. Now that gives us a clear slate. We don't have to own the knowing when we work with our patients in an individual way. And another thing is that we stay humble. Very important in the healing arts. And then we have traditional Chinese medicine, acupuncture being one of the most known to the Western world. And many university clinics today have an acupuncture available treatment. And acupuncture is here to change the fluid and energy flow in the body by using meridians and acupuncture points. That's thousands of years old. And now our trip goes to India. And again, thousands of years old culture. You have right here the 7 chakras, 7 spinning energy wheels that segment from the sacrum all the way up to the crown. And then an Ayurvedic medicine professional would look at the patient in a different perspective and analyzing if they're a Pitta, a Vata, or a Kapha personality. We all know yoga, and Yogananda was one of the people from India, a wonderful spiritual individual that brought yoga to the west coast of the United States. Many of you may know the treatment or the massage with hot oil, Ayurvedic massage, which is so wonderful. And then, of course, we heard this morning already, Dr. Klein talked about the coumarin, turmeric, which is such a wonderful detoxifying spice. And you have all these wonderful colors on the spices and the food. And now we see the biblical scriptures and Jesus hands-on healing. But what does he say? Does he claim that he's the one healing? Or does he put the power back to the patient and says, it is your belief that healed you? Very important message, to not take the claim, but let the patient own the responsibility of healing and staying well. And then there's Samuel Hahnemann. And Samuel Hahnemann, he was the inventor, the creator of homeopathy. About 250 years ago, he was an MD in Leipzig in northern Germany. And he was pretty disgusted with the way medicine was practiced back then. They did a lot of bloodletting. And he seemed to believe that he killed more people than he cured people. And so he stopped practicing medicine. He started to translate medical scripts. And in his readings and in his translations, he found that there's a certain plant that they discovered to cure the symptoms of malaria. So he had this crazy idea that he would just take a little dosage of that plant. And after he did, he induced malaria-like symptoms. So that which can kill you could possibly also cure you. And this is what homeopathy stands for: like cures like. And here in Germany, we call this the globally. And you have different strengths from D to C, working physiologically D1 and working yourselves all the way into the spiritual realm using those homeopathic remedies. And there's Albert, and he says, in the first half of the 20th century, that matter, the solid stuff that we can see and touch, is actually made of energy, subatomic particles resonating at different speeds. He says, in fact, the whole universe is made of vibrating energy patterns, which is cut off here. I'm glad I remember that. And then there's Nikola Tesla. What a brilliant mind. Without him, we wouldn't have any light, or I couldn't speak to you through this microphone. And Nikola Tesla said, if you want to find the secrets of the universe, think in terms of energy, frequency, and vibration. Anytime you see this image, it's time to take a deep breath. Breath is very detoxifying. So let's take a breath. So what is energy? Energy is so many things: wind, heat, light, sound, gravity, pressure, vibration, electricity, magnetism, electromagnetism, chemical energy, and yes, also thought is energy. So using energy medicine we do on a daily basis in hospitals all around the world. There's nothing strange about energy medicine, we just call it differently. We have X-ray, we have EKG, EEG, MRI, and ultrasound that we use to diagnose our patient's health. And more in the therapeutics, and that's why I titled this lecture, Going Mainstream, energy medicine is coming in and giving sister chemistry a handshake in order to implement to the chemistry the electromagnetism, the energy, in order to make the chemistry work better. So here we have massage. All of you had massages in this room, I'm sure. Laser, biofeedback, ultrasound, TENS, microcurrent units, and here the biofeedback combined with focused electromagnetic fields. The US National Center for Complementary Medicine and Alternative Medicine calls this new field in modern medicine, the energy healing, and separates it into two categories as energies that can be measured scientifically by our present standards, like electromagnetic therapy or therapy using sound waves. And then there's the other group, energies that are not yet subject to our measurement, such as energy healing, acupuncture, homeopathy, or the distance healing or Ayurveda. Important, however, is not just to use any frequency. It has to be frequency specific. Just as you choose a certain antibiotic to fit your patient's symptoms, you're not throwing 200 different antibiotics at them and hope that one is going to do the trick. So specificity is necessary. The body needs specificity to heal quickly and lastingly. Just as using your car key. When you come out from the parking lot, into the parking lot from shopping, you push the car key, remote control. You hope that not all the cars in the parking lot are going to open. It's only the doors to your car that will open. It's a specific signal that triggers the doors to open. The same with the remote control. You want your television to go on to channel 2, you have to press the number 2. Tiny fields can have a huge impact on cells. And we have so many peer-reviewed literature available now, so much peer-reviewed literature available to us that talks about certain hertz causing certain reactions in the body, such as 2 hertz would be melatonin secretion. We have cartilage and bone growth all within the 10 hertz region. So this is very well based and scientific information is available on PubMed on electromagnetic field stimulation. I found over 40,000 clinical studies that talk about the efficacy of electromagnetic field stimulation, magnetic field stimulation. That was back in May of this year. So focused electromagnetic fields tap into our cellular communication system. And by doing so, they're impacting the nervous system, immune response, lymphatic flow, and improving metabolism functions. Let's take another breath. And moving on. There is technology in this conference that will prove to you that you can bridge the wisdom of the ancient with today's cutting-edge technology. But to keep it personal, to touch the patient, and offering a personalized approach to stimulate the soul, which is expressed through our emotions, and manifested in and throughout the physical body. So an intelligent therapeutic solution can reveal the root cause of disease. And that is because we're coupling it with a palpation of the radio pulse that we term the biofeedback. And such, when we scan with the handheld applicator, which you see right here, handheld applicator, both screens, we introduce the focused electromagnetic fields while waiting for reaction from the patient's feedback. And the areas that are being revealed can represent inflammation, infectious processes, scar tissue, or unresolved shock or trauma residing as a cellular memory. If we wouldn't have instrumentation like this, never be able to locate inflammation or scar tissue. While we would have elevated CRP, we would not know where the inflammation is sitting. So this technology and biofeedback method can reveal the root cause of our patient's symptoms and disease. So I told you that my middle child, he really was the prompter, and often our children, they're our guides in changing our lives, so looking at ourselves and having an opportunity to transform. And so I did. Energy medicine saved my son from open heart surgery. He was born with congenital heart disease, and at the age of 2, his L transposition was corrected. And he was in the hands of fabulous surgeons at Children's Hospital in Boston. But when he presented a chronic problem at the age of 5, he had a 1 centimeter large thrombus in the heart, and Coumadin just didn't do the trick. He was on it for 2.5 months, and the iron levels were off the chart. He just couldn't get into therapeutic levels with the Coumadin. And it was at this time that I was introduced to energy medicine, this particular technology. And I was very nervous to use it because he had a pacemaker. They cut through the septum, and as a backup system, they put the pacemaker in. Thank God for that technology. So I took this device and my son, brought him down to Westchester Medical Center. I had the cardiologist look through the echocardiogram while the Medtronic pacemaker engineers were there to check the output of the pacemaker while I was introducing the focused electromagnetic fields, because I needed to know if this was going to be safe for my son. And sure enough, I was clear to go, green light, there was no impact. So I had only 1 more week until the cardiologist would have decided to do yet another open heart surgery to surgically remove the thrombus. I did 3 15-minute sessions, and on that Monday, we had the last INR test done, and for the very first time, he was in therapeutic ranges. All I had done was to introduce the therapeutic value of biophysics, energy medicine. So I continued the Coumadin and the treatment with this device, with energy medicine, and after about 3 months, we were able to reduce the clot from 1 centimeter to about 1/3 of its size. He was out of danger. So today my son he just actually last week he turned 18. And he is a troublesome teenager, very healthy. Last check with the University Clinic of Freiburg in Germany showed absolutely, as it has for many years now, for 13 years almost, that there is no thrombus at all in his heart. And his heart, with this very complicated surgery, is doing exceptionally well. So that touched my heart, you can imagine. This saved my son's life. And probably, of course, saved him from open heart surgery. And you never know how surgery goes, especially for a 5-year-old. So what really happened when we used focused field stimulation? What did we affect? Well, I would say number 1, we were able to detoxify his cells, which enhances cellular absorption and thereby improving the coagulation. His mood became much better. He was a happier child on the Coumadin. I don't know if you've seen children that are taking Coumadin. They are outraged. They throw themselves. They are being poisoned. So I saw that my son became happier, and also very important, he could sleep better. So that was what propelled my passion to stand here in front of you and take a journey into diving into the field of energy medicine and make it my goal to educate all around the globe that it is essential that if you want to achieve a significant effect on your patients and hold it and have it done fast, that you cannot miss the realm of electromagnetism. You got to add it. Because we're electromagnetic beings, so why don't we treat electromagnetically? So Suzanne Summers, my husband and I, we were at her home, and I was treating her. She had lymphedema in her left axial region. She had pain, and swelling. And as we usually do, we scan the body and we find dysfunctional areas, and her area was in the right lower quadrant. Had really nothing to do with her breast and her axial region, but that is the trick to unravel, to get to the underlying dysfunction, to the root cause. And as I'm staying on the area, I'm asking Suzanne if there's anything going on there, and she says, you know what, Silvia? This is where I have the scarf, the hysterectomy that I never wanted. And here comes the emotional spill. And I continued using the treatment on those areas, and including the right lower quadrant. 2 days later, she called me. She couldn't believe it. The swelling went down, the pain went down, and that all within a 45-minute session. So she put us into her 3 books. She uses shouldn't say that, but she uses this technology that is just so life-changing for people. Here's a case, myasthenia gravis, very difficult. What do you do with a patient like this? 59-year-old female, and she had several symptoms, including muscle weakness, had the drooping of the eyelid on the left side. Then we have just weakness, overall weakness, and just not being able to lead a normal life. So here we go. We have the before and after 18 treatment sessions. That's a huge change. Look at this woman. That's a brand new woman. And there's no photography retouch. This is from a physician in California who took these pictures with a cell phone. Just beautiful. And here's a case from India, Raynaud's disease. This is before, and this is after only 6 treatments. And we continue. Again, a case from California, peripheral vascular disease. Her legs were supposed to be amputated, but before the surgeon made that last call, he said, see my colleague down the road and let's see what this energy medicine modality can do. And here we go. Only 9 sessions, and the patient could keep her legs. This was in the early years, almost 12 years ago in Tennessee. This patient was diagnosed with probable pituitary cancer. She was lactating after the birth of her last child for 14 years, was in pain all the time, you can imagine, at least your women can imagine. And we had a thermography done before, and after 3 sessions, you see, you have here the heat. The hot spots, the white is the inflammation, heat also again, inflammation, and then here disturbed circulation. And after the 3 sessions you see how the picture is changing. But not only did the thermography picture change, she went back to her endocrinologist who tested her prolactin levels, and she was back to normal levels. Within 3 sessions, she'd been on medication for 14 years. How is this possible? Well, because we added the realm of biophysics, energy medicine. It's time for another breath. So I teach and also use in the Institute, it's the Binder Institute for Personalized Medicine, which we founded this year. And also I didn't mention to you that we moved from New York to Germany 4 years ago. So I've been living a rural village life in beautiful southern Germany with my husband and our children and all the animals. We all moved back to Europe. So our biggest tool is intuition. And I always say it overrides any blood test, saliva, thermography, whatever it is you do. We were all born with the ability to use our intuition. It's up to you to make that decision to use it. I teach and use, of course, on the energy aspect, important for a successful integrated treatment approach is the nutritional factor, and we heard a lot about that already today. Also homeopathy, lifestyle coaching, family constellations, brilliant work by Hellinger that talks about the energies that you carry from your ancestors going back about 4 generations. It could be that your grandfather was in the war and he never really could overcome the trauma that he experienced. And the grandchild today is still carrying that emotional load, that energy, that heaviness that probably will be in the way for this individual to live, or this grandson to live his powerful self. So there is specialized family constellation therapists that work with patients in a very interesting way to help resolve those issues. Environmental stress is a big one. We heard about that already. Where your bed is located in your house, turning off your wireless systems in the house, not using cell phones as often as most people do, and not having it being held to the head especially. So that is an important factor to reduce environmental stress. And then brilliant work by Gerd Hamer, a German physician, radiologist, who talks about the implication of unresolved emotional shock and trauma being the reason of why cancer settles into the body. I recommend you look that up, the New German Medicine, Hamer's work. Epigenetics, Lipton, awesome stuff. We can change our genetics just by thought, belief. Then the bioenergetic field by Valerie Hunt. She unfortunately passed in the beginning of this year. She was such a pioneer, and she died at the age of 96. Manual manipulation is important to adjust the spine and joints. Biological dentistry, very critical to get the amalgams out and to just look at the mouth in a different way. And then Rudolf Steiner, love his work, anthroposophical thinking, Ayurveda, and TCM. So if you're contemplating that maybe this is a good idea to add energy medicine to my practice right away, why would I wait? This is too good to be true. Well, maybe it just is. Then I would suggest that you create more room in your mind so that you can have more space in thinking and integrating energy medicine into your practice. And I recommend you start reading The Power of Now by Eckhart Tolle. I often recommend that to my patients. It calms the mind. Such awesome work. And the next one, and this is a great book, The Hidden Cure, by Lawrence Mars, The 5 Laws of Perfect Health. And then a more scientific approach by James Oschman, Energy Medicine, The Scientific Basis. And then Bruce Lipton's work, The Biology of Belief, that gives a lot of hope to physicians and patients. And another breath. Have you ever thought about beyond your patients seeing you to relieve their symptoms, to getting healthier, feeling better and leading healthier lives? What is it really that they come to see you for? What are they looking for? What are our patients really searching? I gave that some thought. And I think that they're searching for hope. To feel safe. Forgiveness. To be forgiven and to forgive. To be free. To lead a life without fear. To be respected. To feel beautiful. Because if you don't feel beautiful, you ain't beautiful. To love and be loved. And last but not least, to return to the innocent self of how we arrived in this world, naked, ready, innocent, being in the moment. It is time to revisit that place. Be fearless and start to water the seed of power that is within all of you and live your powerful self you've come to live. And this one will not work now, but in essence, this is a little clip, but it doesn't work. That's right. All of you in this room are really searching for the same thing as our patients. I thank you for your time. Thank you.